Hey everyone, this is Dr. Latha, your consultant obstetrician gynecologist. Are you someone who frequently goes on trips or sometimes maybe whatsoever? Do you plan such trips well in advance to avoid any hassles during your trips, or you just book tickets and go away? I'm sure we all would plan very well, isn't it? The reason why I'm asking this is most of them who plan such petty things very well often tend to neglect healthcare choices. For instance, a large number of patients concerningly we see come to hospitals with positive pregnancy test. Of course, we are happy for them, we are happy for the pregnancy, but here I would like to emphasize that the ideal time to visit your doctor would be the time when you actually plan for your pregnancy, which we call preconceptional phase in medical terms. Why? Because we tend to identify any risk factors that you might have and that might cause potential hazards to you and your baby during your pregnancy. So what do we do in such checkups? Number one, we do a meticulous preliminary healthcare check and also tend to identify your risk factors for chronic healthcare conditions like diabetes, hypertension, fits, hypothyroidism, for instance, and treat them accordingly well in advance so that you enter the pregnancy in a healthy state. Number two, we also tend to identify any risk factors for genetic conditions that might be transmitted to the baby by screening the couple or by asking if any of the family members have had an inherited genetic condition, so that it will help the parents to make balanced choices about the pregnancy that they would take up. And number three, very importantly, we discuss with women about their diet and lifestyle choices. We discuss with them about healthy food choices, weight management and physical fitness. Also, we discuss with them about things that they should not be doing during pregnancy, like avoidance of any alcohol or smoking if they are into it, and so as to avoid any such related hazards to the baby. And number four, we also discuss with them about immunizations, vaccinations, because conditions like rubella or hepatitis, for example, can have potential concerns on the neurological development of the baby, or they may cause any growth restrictions or physical abnormalities. So in order to avoid such, we see to that they are vaccinated well in advance, and so that they can enter the pregnancy again in a healthy state. And finally, we also discuss with the women about the medications, what to be taken and what not to be taken. For avoidance of, we educate them about avoiding certain drugs which are unprescribed, and also ask them not to use any illicit drugs, which definitely is going to affect your unborn baby. And also we tend to, on the other hand, we ask them to take folic acid well in advance, which serves to avoid any abnormalities with regards to the baby's brain and spine. And hope this helps, because always keep in mind that a healthy pregnancy starts with a healthy mother.